So welcome everybody. Hopefully you are comfortably situated and ready to pay attention to this evening's presentation, where we are going to be looking at some articles of interest stroke concern coming out of Canada within the last 12 months or so. And we are going to be starting out looking at an article as recent as this week at time of recording, which is the end of January. I'm not entirely sure what the day is, maybe the 27th or the 26th, but it doesn't really matter. It doesn't really affect things in the grand scale of things. But this article that did come out just a few days ago on the Canadian National Observer has a headline that reads, "Canada's mental health crisis requires a national summit," says the Mayor of Toronto. And some of you may be all too aware that Toronto was my home for a good part of 9 years. But Toronto, Canada, the mental health crisis demands a national summit with representation from all levels of government, John Tory, the Mayor of Toronto, says on Wednesday, and claiming that there is a lack of provincial and federal support. And it is offloading responsibilities onto ill-equipped municipalities. And in the statement, Tory called for a summit that would see mayors, ministers, premiers, and the Prime Minister discuss better on how to support people living with mental health and addiction challenges, which is becoming quite an increasing problem in Canada. Not only Canada, I think it is a trend worldwide. People are becoming more and more susceptible to mental health conditions and are suffering from them. But coming out of the COVID-19 pandemic, Tory said the lack of spending on mental health is painfully clear on the streets of Canadian municipalities. This summit must be the moment we start treating mental health care as healthcare, and that we clearly decide on who has a responsibility to do what, who they might lead or land that responsibility to. We may discover a little bit later in this stream. But how to get on with doing much more together, he said, is what the aim of the summit will be, and they're going to come up with solutions, hopefully, for this problem. Maybe solutions already exist that they are just ready to implement for mental health sufferers. But the mayor has routinely linked issues of mental health support with recent random violent attacks on Toronto public transit, something we are going to be looking into also during this presentation. But for the moment, we'll continue with the article at hand, which says police have reported 3 incidents on the city's transit system in the past 4 days alone. And the Toronto transit system was something I used to use sort of regularly, almost on a daily basis for the 9 years that I was there. Very strange and interesting experience that is, or can be, depending on time of day or direction you are going. But it seems there's a little bit of a trend, in a widespread trend across Toronto and maybe Canada, of people getting stabbed on transit systems. But a woman was stabbed to death during a random attack on a subway in mid-December, and Tory said more mental health investments were required to ensure people in crisis had places to go other than the transit system. I wonder where they might suggest or if or not they have places for these people to go ready and waiting. But when the federal and provincial governments don't fully and adequately fund mental health care, the responsibility is offloaded to the ill-equipped municipalities across Canada, he said in Wednesday's statement. He also went on to say it is offloaded to our shelters, to our police services, and to our transit systems, and to hospital emergency departments. Now, For a few months of my stay in Toronto, I actually found myself homeless, and sometimes during colder, wetter or snowy, icy days, a very good place to sort of hide and shelter and not sort of really be disturbed was to sort of get on the subway train and just sit on it till it got to the end of the line and waited for it to turn around and go back, and sort of stay there for as long as possible. At least you were sort of warm and dry in can able to have a little bit of a shut-eye while you're on the train. But continuing with the article, he was asked to respond to Tories' comments. Ontario Health Minister Sylvia Jones pointed to the province's investments in crisis response teams that match mental health professionals with police officers. There is no doubt more work needs to be done, said Jones, speaking at a news conference on Wednesday morning, and I'm always willing to work with whether it is police forces or municipal governments. And I think, now we have a little bit more. The Office of Federal Mental Health and Addictions Minister Carolyn Bennett said making mental health care an equal part of the universal healthcare system is a core part of the government's plans. What the government has planning for that, who knows? Governments do tend to plan some very nefarious things that they try to pass off as being in our best interests or for the safety and security of society. But it is said that the department is continuously working with the provincial, territorial and municipal and Indigenous governments on a comprehensive mental health and substance use strategy. The Prime Minister will be meeting with premiers on February the 7th to ensure sustainability, a word that is being dropped around, thrown around an awful lot in recent times, to ensure sustainability of our system for years to come. A little bit just like Agenda 2030, ensuring the sustainability to the Earth system for years to come for the few lucky souls that will remain in place to enjoy it. But to ensure our investments deliver real, tangible outcomes, including reducing backlogs and wait times, ensuring access to family health teams, improving mental health services, advancing use of health data, and supporting seniors. Bennett's office said in an email, the best evidence of ongoing mental health crisis is the issues related to substance abuse, Tory said, noting that thousands of people have died from opioid overdoses, and that is actually the case. It's getting on for a year and a half since I left Toronto, and when I was there were actually sort of Red Cross and sort of other charitable agencies that had sort of set up little sort of tents and tables in and around various parts of the city that were sort of giving out overdose kits to passers-by. Anybody who wanted one could sort of have one, and this was because there's a good chance you may and will encounter somebody overdosing on your daily out and about routine in Toronto, and that was sort of then. Who knows what it is now? And I know sort of Vancouver is sort of the epicenter of opioid addiction in Canada. But Tory says he first made the proposal for a national mental health summit directly to Trudeau in December, and 3 years ago we were confronted with COVID-19 pandemic, and in that moment all governments worked together to help people and to help each other. Of course they did get through those tough times. Now we are facing a mental health crisis that requires the same level of dedication, cooperation and commitment, whatever that means. And this report by the Canadian press was first published on January the 25th, 2023, just a few days ago. So there you go. There's a little article outlining in sort of highlighting the problems of mental health issues in Canada. And often or not, when there is a problem that is faced to government, they more than often have a solution ready and waiting to tackle that problem, and what solution could they possibly have up their sleeves to tackle the problem of mental health issues in Canada? We are about to investigate in our next article of interest in this preacher presentation, Canada in Crisis. Here we are at the CTV News website, ctvnews.ca, for anybody who wants to find it for themselves. And the article reads, 9 things to know about medical assistance in dying for mental illness. And as we just suggested, there is more often a solution laying in wait for any problem governments may encounter and have to deal with. It and is made medical assistance in death the final permanent solution to a temporary problem of mental health issues. And this article come out on January the 23rd, 2023, just 2 days before John Tory declared or called for a get-together of the nation's bigwigs to see what they can come up with to solve the problem of mental health in Canada, the ever-growing problem of mental health issues in Canada, I hasten to add. But in Canada, medical assistance in dying, in brackets there, the acronym M.A.I.D, is changing in 2023. And people who have a mental disorder as their sole underlying medical condition will become eligible for an assisted death. Yes, you heard that right, folks. People who are suffering with depression can now go along to their medical assist in death center and be legally euthanized. State-sponsored suicide in another description maybe, but originally that was scheduled to happen on March the 17th of this year, but the government has asked for a delay. And here are 9 things the CTV would like you to know about medical assistance in dying and how it affects people with mental health. Number 1, it is part of the changes to the M.A.I.D law that began in 2021. And it goes on to say that when assisted dying first became legal in Canada, it was only available for people with terminal illnesses like cancer. And it is these people that were eligible and only eligible to use this service or system, whatever you want to call it. But in March of 2021, the law changed to include people who had physical conditions like chronic pain, who weren't actually dying, or in other words, their death wasn't reasonably foreseeable. They could just go along and sort of put an end to their suffering or the painful conditions by being accepted into the M.A.I.D service. And below, or before the article continues, there's a list of related stories, and just look how many stories they are pushing concerning medical assistance in dying. A rare look at Canada's growing demand for medical assistance in dying. A woman with chemical sensitivities chose medically assisted death after a failed bid to get better housing. The death debate, why some welcome Canada's move for assisted dying for mental illnesses and others fear it. Another article there, Canada performing more organ transplants from M.A.I.D donors than any other country in the world. Soylent Green Society is here, alive and kicking in front of our eyes, folks. But experts clash on whether medically assisted dying system is ready for expansion by March. Veterans Affairs Canada's service agent who raised medical assistance in dying no longer an employee. Canada should delay M.A.I.D for people with mental disorders, a psychiatrist says. Just a few of the other articles we could have contained in this presentation, but for efforts to try and keep it to a respectable time frame, you can look into those for yourself if you so wish. But psychiatric illnesses, which some say can be serious and incurable were excluded for 2 years while federal officials studied how to safely include them, not dismiss them, how to safely include them along with physical illnesses. A special federal joint committee was set up to study assisted dying, including how M.A.I.D could be provided to people with mental disorders. And I guess if you click on that blue highlighted link there, it will take you to the intern report. But a final report from the Joint Committee was due in October of last year, 2022. And an expert panel studying M.A.I.D for mental illnesses also issued a report, which you can click the link on there, which we will not do, as I said, trying to keep this within a respectable time frame. But the number 2 thing they want you to know is no specific type of mental disorder is excluded from qualifying for a medically assisted death. And there are many, many, many categories and listings for all sorts of mental disorders, which now are all eligible to get state-sponsored suicide. Like physical illness, a person asking for M.A.I.D must be found by assessors to have a grievous and medical condition. Excuse me if I butchered that word. It's a little bit of a tongue twister for me. Meaning a serious and incurable illness, disease, or disability in an advanced state of irreversible decline with intolerable suffering. In countries like Belgium and the Netherlands, which have allowed assisted dying from mental disorders for 2 decades, requests are made by people suffering from a variety of psychiatric conditions, including depressions and other mood disorders, PTSD, schizophrenia, psychotic disorders, neurodevelopmental disorders like autism, and personality disorders like borderline personality disorder. Going on to the third thing they would like you to know, defining an incurable mental illness isn't always easy. People who ask for M.A.I.D for a mental disorder will be assessed on a case-by-case basis to determine if the person's disorder is grievous and irremediable. In countries with psychiatric euthanasia law, that usually requires proof that the patient has had an extensive history of trying therapies that didn't work, and a second assessor must agree the expert panel's recommendations that one of the assessors must be a psychiatrist independent of the person's medical team, and an expert in the mental disorder the patient has been diagnosed with. Number 4, as with all forms of medically assisted death, the patient's doctor, psychiatrist, or family do not have to be part of the decision and may not know about the M.A.I.D until after the person has died. And also recently, in this year, I believe, they are extended M.A.I.Ds to adolescents without parental consent, which at the moment I'm having a struggle and difficulties and struggling to find that article. But trust me, guys, they have extended M.A.I.D services to adolescents, and in many cases they don't need parental consent to get this. But physicians and families are never allowed to speak with each other if a capable person asks them not to, whether it's about M.A.I.D or any other healthcare practice. According to the expert panel recommendations, assessors shouldn't try to obtain input from other sources, including the patient's physician and family. However, if the patient asks the assessors not to contact the family or their mental health practitioners, they are required to respect the patient's wishes. If the assessors determines that they cannot do a proper assessment without the family or another doctor's involvement, then the patient can be turned down for M.A.I.D. Additional mental health treatments can be recommended before a M.A.I.D approval is number 5 on the list of 9 things they want you to know about M.A.I.D for mental health issues. But the patient can also say no to any additional therapy. The expert panel on M.A.I.D for mental illness recommends that M.A.I.D assessors should ensure that people have had an extensive treatment history and access to appropriate care. The legislative safeguards also say that a patient must have seriously considered additional treatment. However, under Canada law, no one can be forced to undergo a treatment they don't want, and refusing treatment does not mean that a person has automatic access to M.A.I.D. Number 6, people can have a medically assisted death even while they are waiting for treatment. This point has caused a lot of controversy in Canada, and some doctors argue that a patient must have access to the fullest possible range of treatment, including social supports like housing, before becoming eligible for M.A.I.D. And it's very interesting that they mention housing and social supports there, because we're going to have a little look at a video in a second about a homeless individual who is, or an individual who's imminently about to be made homeless, who is considering M.A.I.D as an option rather than living on the streets. And they want them to make the social supports available before becoming eligible for M.A.I.D. To get back to the article, as I did digress slightly there. They say that if someone is waiting for treatment, it means that person doesn't have an incurable illness because they haven't tried anything to get better. However, others argue that just because a person is waiting for treatment doesn't mean their illness is incurable. They say people can wait for treatments that are unlikely to improve their condition. In number 7, the doctors are calling it a state-sanctioned suicide. Doctors disagree on whether it is possible to distinguish between a person who is requesting M.A.I.D because they are suicidal and one who is requesting M.A.I.D after serious consideration. Some psychiatrists argue that patients request M.A.I.D when they're suicidal, and therefore doctors should never help a mentally ill person end their life. A very big debate. Indeed, there is somebody who's just feeling a little bit suicidal, don't want to go on with things, can choose state-sponsored suicide, as doctors are suggesting it is. But number 8, some experts believe that the number of M.A.I.D deaths among those with mental disorders is likely to be low, while others believe it will be high. Data for some countries in Europe show that only 1 to 3% of deaths from euthanasia are from among those with mental disorders. Reports from the Netherlands show that only 5% of requests are made by persons with mental illnesses, and they are granted, and the vast majority are rejected. Critics say that in Canada, the number of mentally ill people that will die by M.A.I.D will be high because our legislative safeguards will be less restrictive. They argue that Europe requires patients to try certain treatments and they have better access to mental health services. But the final thing that they want you to know, number 9, in the past, mental illness hasn't prevented a person from accessing assisted dying. Since assisted dying first became legal in Canada in 2016, a person with a mental disorder could still qualify for M.A.I.D provided they had a physical illness that made them eligible. For example, a person with terminal cancer who may suffer with depression, or a person with chronic pain and have anxiety, would be eligible under the fact that the chronic pain or the cancer was the main reason for them to be eligible for M.A.I.D. The sort of secondary factor would be that they were also suffering from mental health issues. But as long as a patient also had a physical illness that met the eligibility criteria, they could qualify for assisted dying. In 2023, people will no longer have to have a physical illness to qualify. They can be eligible solely because of their mental illness. So guys, you tell me, is it a coincidence that in 2023 or later in this year that people with mental health issues will be eligible to use medical assistance in dying, which is legal in Canada, a nation which is suffering with a mental health illness crisis? Let you be the decider of that one, if or not this was a predetermined solution to an ongoing problem in Canada concerning people suffering with mental health issues. As I mentioned a little while ago, we are going to now look at a little video coming out of Canadian mainstream media, which is going to tackle an individual who is not doing so well for himself mentally and is about to lose his home, who is considering medical assistance in death.
Imagine choosing death over homelessness. That's what one St. Catharines man is contemplating. Tonight on City News, we continue to delve into medically assisted dying and how some believe it is their only option to living in poverty.
Are you afraid to die?
Who isn't? Yeah,
Amir Farsood has applied for medically assisted dying, known as M.A.I.D. He lives in constant agony due to a back injury, but has started the process for end of life because his rooming house is up for sale and he can't find anywhere else to live that he can afford. He barely survives on Ontario disability support payments, which are just over $1,200 a month. He doesn't want to die, but being homeless is not an option.
I know in my present health condition I would survive it anyway.
Farsood meets the criteria for M.A.I.D, physical suffering due to disability that cannot be relieved. His doctor, who knows Farsood's real reason for M.A.I.D is his fear of being homeless, signed off on the application in August. Farsood needs a second to do the same. There's a 90-day waiting period. He believes he could potentially access M.A.I.D in about a month.
I don't wish to be dead, even with the pain, even with the meds. I still want to be here.
The CEO of Dying with Dignity Canada, a charity for end-of-life rights, says the organization has raised concerns about cases like this with the federal government.
The fact that people are feeling compelled to apply for M.A.I.D or to even ask about M.A.I.D because they can't get the basic fundamentals to live a life it's shameful. You know, as a country, as a government, we should be ashamed.
When medically assisted dying became legal in Canada in 2016, it was only for people facing imminent death. Accessibility was expanded last March.
We have created a system where ending of life is an easier and cheaper solution than actually investing in healthcare and social support.
Trudeau Lemons is a professor of law and bioethics at U of T. He argues M.A.I.D devalues the life of people with disabilities who often live in poverty.
I actually had not expected that it would go so fast and that this particular issue of people living in poverty asking for medical assistance in dying would so rapidly take off in the Canadian context and that physicians would sign off on it.
So what is the solution in your mind?
The solution is, in my view, to go back to the drawing table.
The Netherlands has monthly commissions that review troubling assisted dying cases. Canada does not. It does publish yearly stats. The latest shows last year M.A.I.D accounted for 3.3% of all deaths in Canada, or 10,064 people. That's a 32.4% increase over the year before. 65% of cases report cancer as the underlying reason. 81% of requests resulted in the administration of M.A.I.D. The average age is 76. Amir is 54. While he doesn't want to die, he wants to have the choice.
At the end of the day, it's a personal decision.
City News asked the federal government for comment on this story. In an email response, it points out there are enhanced safeguards and states it is highly unlikely 2 doctors would deem a person eligible for M.A.I.D if they had reason to believe their, quote, suffering could be relieved on a sustained basis by access to reasonable and available treatment and social services. Canada is one of the most liberal countries in the world when it comes to medically assisted dying. In March, it's further expanding eligibility to include people with mental disorders. It's expected M.A.I.D will be about 4% of all deaths in this country. That's in line with Belgium and the Netherlands. We will keep in touch with Amir Farsood.
Right, guys, we will be momentarily moving on from the topic of M.A.I.D, but before we do, I've brought you over to Google for demonstration purposes to show you just how many different outlets and sources are selling the same narrative that we just saw in the video before. And some of you may be in the mindset of considering that the individual that we just saw is a genuine person that is suffering with depression, who, you know, rather than face a life of homelessness and poverty, is considering and seeking medical assistance in death as a solution to his problems. And some of you might be in the mindset that he may well be a crisis actor playing the part of an individual who is suffering from depression and facing poverty, who is considering medical assisted death as an option. Either way, the mainstream media and many outlets up there in Canada are selling the same message, which is why I've brought you over to Google, as it is the world's leading search engine of choice. And anything you do type in a search bar, you can rest assured Google will deliver to you the results it really wants you to be seeing. And as you can see, I've typed M.A.I.D option poverty in the search bar, and the first result we get is from the CBC and Canada, that says this woman is considering medical assistance in dying due to A, and we have to click on it to see what the remainder of that headline says, if we can do so in a prompt and sufficient time. There we go. Good old 5G internet rapid speeds at work for you there. This woman is considering medical assistance in dying due to a disability, but poverty is also a factor. Jackie Hollyoak is debilitating fibromyalgia and struggles to live on disability benefits, which was the case of the individual we heard from before. And there's a picture of this lady seeking M.A.I.D also to refrain her from having to live a life of poverty on the streets. And she doesn't look too depressed or unhappy about things in that picture. If anything, she looks quite upbeat. But people who live on benefits and welfare anywhere in the world are considered a drain on resources by government. And we heard in the video also that they said that it is an awful lot of a cheaper option to euthanize people who are homeless and living in poverty than it is to house and feed them. But back to Google, just to show you some of the other results that are coming up, and there are an awful lot of them. This Canadian can't afford to live. She might choose to die. And that was from July of last year, and I'm kind of imagining that might well be the same individual as we saw above. Let's see if there's a picture of her. She's from Vancouver. Madeleine was 8 when her body started to rebel. So no, it isn't the same woman. There's another example. So there's 3 different individuals now from 3 different mainstream sources in Canada, all selling the same story, that someone with either depression or a medical condition, but who is also in poverty, that you can use your depression or your mental health illness as a loophole to gain access to those services that would otherwise be you would be ineligible bearing in mind in March the parameters will open up to include people with mental health illnesses, and how many people in the last 3 years alone have contracted mental health illnesses is quite an astonishing number, without bringing into or countering in the factor of people who pre-COVIDian era also suffered from such disabilities as dementia, depression, post-traumatic stress disorder. Moving down, there's a video on YouTube that fears of people are choosing M.A.I.D because they can't afford to live, and there is the individual that we just saw there. Ethics of a medically assisted death questioned by some, questioned as some turn to it as and we'll click on that just to see what it is, an alternative to poverty. The assisted suicide doctors who admit patients are driven by poverty is another article there. Are Canadians being driven to assisted suicide by poverty? Myths and facts there, nothing to mention poverty there. Hungry, poor and disabled Canadians now seeking assisted death. Why Michael, another individual, chose death over a life of pain and poverty. Assisted suicide for poverty, Canada case. National review of medical assistance in dying, part 3. M.A.I.D must not be an option for poverty. M.A.I.D must be response to poverty or a lack. So you can see, guys, the narrative is the same in all of these articles, and this one is no different. Canadians turn to euthanasia as a solution to unbearable poverty. Woman offered assisted suicide for abject poverty as she couldn't get housing for her disability. The Life Institute. She was offered it. She didn't choose it. She was offered it. Now, you know, a very familiar sight of the past 3 years in the hands of a man in a white coat there. So we're not going to read too far in it. A breaking story from Canada that should be compulsory reading from anyone. A 31-year-old woman living with disabilities has been approved by doctor to have her life ended by assisted suicide because she has tried in vain to secure affordable accommodation which would assist in her to live. And who provides her with the affordable accommodation with the assisted living? That would be the government. So let's click out there. As I said, we're not going to read all of these. You can do so if you want. You can follow my example, put M.A.I.D option poverty in a Google search engine, and you can read any of these at your given leisure. M.A.I.D is not driven by social economic vulnerability or poor access to palliative care, although you would be forgiven for thinking that it was, given all the amount of articles that we have just witnessed in these few short minutes here on Google that come up as a result of typing M.A.I.D option poverty. So they really are selling this idea up there in Canada, and you know, one could sort of question how long is it going to be before you can voluntarily choose this option to sort of end poverty, and how, you know, soon or if in, but let's hope it doesn't come to the time where you may not have the choice. But there you go, guys. Let's just get to the bottom of it so you can see for yourself just how many headlines and articles there are that are selling the idea that M.A.I.D is the solution to poverty, either pro or against. And you can see for yourself that it really is quite a saturation campaign to get this message out. So moving swiftly on from medical assisted deaths in Canada, we're moving ourselves in the direction of COVID quarantine stroke isolation camps. Stay tuned, guys. Canada in Crisis will continue momentarily. Here we find ourselves at pre-search, where you should be able to see for yourselves that in the search bar I've typed Canadian isolation camps, and we are going to scroll down very quickly. There's an ad at the top there for something over, but the first article that we come across is Government of Canada announces funding for COVID-19, and this is actually from the Government of Canada's official website. If it will open, there we go. You can see for yourself, Government of Canada, canada.ca, and it starts by saying the Government of Canada has announced funding for COVID-19 safe voluntary isolation sites in British Columbia. And this is actually from back in November 26, 2021, Ottawa, Ontario Public Health Agency of Canada. And this is pretty much province-wide up there. The government has issued funding for isolation camps up there to the sum of $99 million, I believe. But the Government of Canada is working with partners to protect the health and safety of Canadians and temporary foreign workers in Canada, and to reduce the spread of COVID-19 and its variants in Canada. Self-isolation is one of the most effective ways, not a lie if you believe it, to help stop the spread of COVID-19. However, for some people in Canada, crowded housing conditions and high costs can make it unsafe or impossible to self-isolate, putting themselves, their families and communities at risk through no fault of their own. But today, the Honourable Jean-Yves Duclos, the Minister of Health, announced more than $5 million to support the following two projects in British Columbia through the Government of Canada's Safe Voluntary Isolation Sites program, an employer-based reimbursement program for agricultural workers living and working across British Columbia through the Government of British Columbia's Ministry of Agriculture, Food and Fisheries to help support agri-worker isolation's needs, and to provide a safe voluntary isolation site in the city of Surrey through the Fraser Health Authority. Voluntary self-isolation sites help people who have COVID-19 or have been exposed to it access safe isolation accommodations to keep themselves and their community safe. These sites are in addition to the facilities available for people experiencing homelessness. We just heard how some people are dealing with homelessness and maybe rounding them up into a camp. You might be able to drum it home to them, you know what, you're already going to be better off dead than living here. Who's to say that isn't going to happen? But people who are experiencing homelessness who need to isolate because of a positive test. Can't imagine many homeless people lining up to get themselves tested. But voluntary isolation sites reduce the risk of spreading the virus amongst household contacts in situations where people are faced with crowd. Why is that doing that? Sorry. The Safe Isolation Sites program directly supports cities, municipalities and health regions that are at risk of COVID-19. Community transmissions. Sites selected under the program provide an accessible location where people can safely self-isolate for the required people. local public health officials determine eligible people who may be offered the option to transfer to the isolation site on a voluntary basis to keep them and their household contacts safe during an outbreak in their community. So, reading into being into that people may be offered the option to transfer to isolation on a voluntary basis. Something I want to sort of draw to your attention here, that ICE, the Immigration and Customs Enforcement Agency in the United States of America, offers detainees who are about to be deported the option of a voluntary departure, which means they pretty much get put on a bus and sent back to Mexico within the day or two of their arrest, rather than face time in an ICE detention facility, which could be an insurmountable amount of time. The sort of you can kind of volunteer to do something when the sort of alternative is really, absolutely terrible, and you've got no other option to select the lesser of the two evils, if there is a lesser of two evils. But offering people to volunteer could almost be forcing them to do something or face the consequences, or an alternative that is far less desirable. Let's just leave it at that. And there are a few quotes at the bottom there from various parliamentary officials up there that are sort of singing their praises for these camps, or selling their views and support for them. And here is another one from, it's pretty much the exactly same word for word, talking about it in Windsor and Essex, and this is from August 19th of last year. And again, it is pretty much the exact same article that we read before, word for word. So COVID plans include family separation and involuntary. Let's see what this one's got to say here. And so I always tell you, make of it what you will. I've not actually read this article prior to this, so this is as new to me as it is to you. I'm just clicking on the links that seem to have interesting headlines. COVID plans include family separation and involuntary quarantine camps. The CDC calls for isolation camps as part of a shielding plan. The plan subjects US citizens and residents who are deemed high risk for COVID-19 and to be forcibly removed from their families and homes and involuntarily isolated in camps. And the public first got wind of this impending nightmare in May of 2020 when Governor Gavin Newsom of California announced that the Army, his word, will start with a deployment of 3,000 and grow to 20,000 mark to chase down who, what, where and when with whom COVID positive people have had connections, and tracing a component requires a workforce, and to identify individuals who tested positive to ID their contacts and maybe quarantine individuals to stop the spread of the diseases. And there's a few videos and stuff there. As I said, we're not going to read all of that. We're just clicking on just to sort of highlight it, although that was actually in the United States, not Canada. PM health officials warn Canadians about believing COVID-19 isolation camp, internment camp disinformation. Disinformation campaign falsely suggests Canadians will be forcibly sent to quarantine sites. As we just read from the government themselves, it can offer individuals the choice to volunteer to go to these. Just because they're sort of volunteering doesn't necessarily mean they made the choice from themselves. They may be forced into it, but it says that they will not be forced into it. They will be given the option to volunteer to go there of their own free will, though they might have an escort with them. But the federal government has announced funding for voluntary quarantine sites for some of the country's homeless, and has made plans to expand self-isolation capacity for returning international travellers without suitable places to go. But Canadians will not be compelled to leave their homes for so-called COVID camps, and the answer is no on that one. But isolation internment camps in Canada, there is an article there. Guidance for managers and operators of industrial work camps. Now this is interesting, guys. I have actually clicked on this, and we do have to download a PDF, which we will open for you to see. So guidance for managers and operators of industrial work camps. And again, this is an official government PDF document that is being distributed for stuff. It's got numbers in Department of Health and Safety, references and contacts for people working this. And I'm guessing this is a training manual or guidelines, standard operating procedure for employees and managers who are working and overseeing industrial work camps. Let's not forget, guys, the National Socialists back during World War II had industrial work camps, but under current Chief Medical Officer of Health orders, businesses and entities are required to implement practices to minimize the risk of transmission of infection among attendees, to provide procedures to rapid response if an attendee develops symptoms of illness, ensure that attendees, I'm guessing attendees is the rebranding for detainees, ensure that they maintain high levels of sanitation and personal hygiene, and to comply to the extent possible with the workplace guide to business owners. And this guidance and any other applicable Alberta health guidance found at www.alberta.ca. It is a government website, folks. So this is a government a document that is being distributed to individuals and managers that will be overseeing, that word again, industrial work camps or quarantine isolation camps. Now, as we said, guys, the Canadian government has issued millions and millions of dollars for the introduction or the construction of these isolation sites. And when a government is spending this sort of money on something, you can bet your bottom dollar that they are going to find a way to use it. And as you can see, this sort of PDF is sort of quite detailed. It would take a considerable amount of time to read it all here, but you can see for yourself, it is a standard operating procedure and a list of protocols for employees designed or that will be designated to be working in industrial work camps. They're not quarantine, they're work camps. What are the individuals that, you'd think detainees that are supposed to be quarantined for their own safety and the safety of others wouldn't really be able to work, or going to work would be quite difficult unless it was in segregation. Rapid response plan, responding to an elevated risk of COVID-19. Work camp operators have a responsibility to prevent the risk of COVID-19 transmission to staff, clients and visitors at work camps, and to provide the rapid response when a person develops relevant symptoms and is required to be in isolation or is required to be in quarantine. If there's much of a differentiation between isolation and quarantine, who knows? But I guess there is. This appendix details the minimum criteria that operators must incorporate into their written rapid response plans to ensure their readiness to manage symptomatic individuals, confirmed cases of COVID-19, and respond to an outbreak should one occur. Going to guess one will occur. And again, if you sort of isolate or concentrate a whole bunch of people who may not have been vaccinated, for example, and ask yourself, what sort of people do you think will be ending up in isolation camps? Will these be people who've had 4 or 5 shots of the vaccine? Or will these be the sort of non-compliant, resistant types that didn't comply and go up and wait in line to get their vaccine? I'm guessing that it will be the latter of the two demographics of population that will be inclined to find themselves being part of the population in these industrial work camps. So, as I say, guys, it's very, very long. You can see for yourself many pages of information on how managers and employees need to carry out their protocols and procedures within an industrial work camp. Make of that what you will. Safe voluntary site in the region of Waterloo. Canadians detailed traumatic stay in a quarantine facility, and that brings us down to the end of the list that showed us Canadian isolation camps. So they exist, guys. They're there. The government themselves on their own website are telling them that they are giving funding for these projects, and if or not these projects or these camps are going to be filled in the not so distant future, that remains to be seen. But who do you think they might be recruiting or relying on to possibly go around knocking house to house or rounding up individuals that may have tested negative, that are refusing to isolate, and take them to these facilities? Well, stay tuned, guys, because we're moving on to our final segment of Canada in Crisis, where we're going to be looking at the Canadian military recruitment page on their website to see some interesting positions available at the Canadian Army opening up almost immediately. Some of them even have signing on bonuses, so we will be looking at that right now. So we are going to wrap things up once again at a Canadian government website, this time the website of the Canadian Armed Forces, where we are going to browse the careers section and look at 1 or 2 interesting vacancies that are currently available if you are looking for work and have a particular background. The Canadian military is currently hiring, and in some cases giving you signing bonuses up to $20,000. Now, a little while ago, or maybe longer than I may realize, this time does seem to take on a new meaning here in the tropical climates that I now live in, as opposed to they did when I once resided in Canada, and sort of time come to a standstill during winter. Time does seem to fly here in the warmer climates. But as I was saying, and before I digress, I was looking at I came across an article that went on to say that the Canadian military was currently looking to recruit either 25,000 or 250,000 medical officers for future deployment, either domestically or internationally. And now, if it was 250,000, which I don't know why I'm thinking it was, but it is very easy sometimes to see an extra zero. But that is an awful lot of medical personnel for a military, and especially a military for a nation that only has a population of 38 million. And I'm not entirely sure, though I could have looked up the size of the Canadian military, it does seem an awful lot. So let's sort of go with the assumption that it is 25,000. And I have in fact spent the last 3 to 4 hours trying to relocate that article for the purposes of reference in this presentation. So I'm not going to ask you to take my word for it on that front, but we will proceed to look into the career section here at the Canadian Armed Forces website to look at one or two that are of particular interest, in concluding the medical officers. Now you can see here I filtered it out to show just the healthcare section, and it is currently displaying 24 of 101 careers that are currently available with the Canadian military. Now that is approximately a quarter of the recruitment or the jobs available. A quarter of them do seem to be within the medical field. Now I understand that militaries and armies and stuff, they do need medical personnel, certainly in times of conflict and in the field. They need the medics and stuff to take care of injured troops and wounded civilians in some cases. But in terms of having to be deployed on domestic service, in the case of humanitarian aid, be it a natural disaster or something like that, would only really be applicable in sort of cases of martial law, because normally they do not, domestic deployment is not something that governments command militaries to do. It is only in a dire, extreme emergency situation that would come to place, that you would see your own military on your own hometown soil. So it's very interesting that they are taking on an awful lot of military medical personnel for deployment, either domestically or foreignly. And this could mean one or two things, or it could even mean both of the things, that this is in fact a military takeover of the medical industry in Canada, which would sort of go along with the socialism, totalitarianism of the state running and controlling everything. Although there is a sort of state-provided national health service already in Canada, it does seem to be under a lot of bit of scrutiny and getting a lot of sort of backlash, as many medical industries are in the world at the moment, over the vaccine issue. But there could be, as I said, that there might be some futuristic, not futuristic in terms of sci-fi, but within a not so distant future, there could be, see a military takeover of the medical industry in the Canada there. Or secondly, it could mean that they are either preparing to go overseas in order to tend to what might be a mass casualty situation. And at the moment, in contemporary times, there is rumours that we're minutes away from World War III, which might lead me to reboot a Watchmen Decoded stream in a not so distant future, because the world is beginning to mirror the realms of that fiction. But back to reality, back to life here at the Canadian Armed Forces. 24 positions currently available, not 24 positions, but there are 24 openings for individuals to apply for within the military, within a medical field. We have at the top of the list there internal medical specialists and medical officers, and this is the one that I wanted to look at, because this is the article that I read that said that they wanted to recruit either 25,000 or 250,000 personnel medical officers, and medical officers with certification in the College of Family Physicians, and who hold special competency in emergency medicine, provide specialized urgent and emergent resuscitative care and instruction in both pre-hospital and hospital environments for Canadian Forces Health Service training and deployed operation. Now, when it gives you an overview, I don't know why you have to sort of scroll down a little bit before the words, there you go, appear. So let's go back up. So the overview of a medical officer with certification in the College of Family Physicians and all the stuff we just mentioned above will be required to provide specialized, urgent and emergent resuscitative care and instruction in both pre-hospital and hospital environments, which I've already said above. For Canadian Forces Health Services training and deployed operation, they have the opportunity to be a leader within the Canadian Forces Health Service and serve as mentors and educators to the full spectrum of military health care providers. Their primary responsibilities are to be part of a multidisciplinary emergency resuscitation teams in Canada and in deployed settings internationally. And again, they say in Canada, to provide in transport. I mean, in Canada, that could well be training facilities or, through recruitment in stuff like that. But let's not rule out that they might be on actual deployment required to provide medical assistance in an operation on Canadian soil. But provide in transport care for injured or ill Canadian Armed Forces members during an evacuation, which might lead us to believe that they might be sending them overseas to provide medical assistance to frontline troops, perhaps, that may need to evacuate or retreat. Educate and advise multidisciplinary teams on emergency resuscitation. Maintain a high level of clinical skills by holding a position within a civilian healthcare facility, which is quite interesting, having the military working along civilians. That's, again, a little bit in the realms of socialism. But it has to be a facility that meets with approval from the Canadian Armed Forces and meets their requirements. And they need to contribute to the development and application of healthcare policies within the CAF. The work environment of a medical officer in the Canadian Armed Forces is to maintain their clinical readiness by being embedded as clinical staff. And embedded is an interesting sort of word. You sort of embed a mole into the opposition's camp in order to sort of retrieve information that may be a benefit to you, to maybe defeat that enemy. But an interesting choice of words there. But they will be embedded as clinical staff in civilian hospitals across Canada, working alongside their civilian colleagues. In addition to primary clinical duties, participation in education and in training tasks, as well as research opportunities, occur nationally and internationally. They belong to the Canadian Field Hospital and maintain their operational readiness by participating in annual military skills training and field exercises when required. They will be called upon, however, to deploy to unique and challenging clinical environments as part of a health service team on domestic and international operations. And there is the pay and benefits package there. Now, going on, radiologist, social worker officer, that's pretty interesting. Why would you need social worker officers within, I'm not saying that you wouldn't need them, but it does sort of seem something that might seem a little bit unnecessary for military purposes. It sort of seems more like a more civilian thing, but what do I know? I've never been in the military myself, but a signing bonus goes down to anesthesiologists, and obviously anesthesiologists anesthetize people or put people under so that they can be operated on, but they essentially are personnel that are trained to deliver injections. And when we're talking about a medical or a military takeover of the medical industry within Canada, excuse me, that didn't go away anytime soon. There might be a reason for the necessity to have military personnel working alongside civilians in hospitals, and possibly within domestic deployment at quarantine isolation camps, and maybe as part of domestic deployment they might be required to go around neighborhoods door to door, checking on civilians vaccine status, make sure their passports are up together, and maybe if or not you're up to date with all your required jabs, and if you're a person that has avoided it in non-compliance and went against the wishes of your government to get a vaccine and remain unvaccinated. Maybe the military that come knocking on your door to check everybody's up to date and find out that you're not might enforce upon you the choice of voluntarily going to the isolation camp, or maybe something worse if you don't, like maybe a re-education center. But they also need some biomedical electronics technologists and a bioscience officer. Maybe for biological warfare, perhaps, who knows. But when you do click on these, there's pretty much word for word exactly what they said, with the exception of what sort of the job descriptions require. But all of them do contain the same language that they may be called upon, or they will be called upon for deployment on domestic or international soil. So they also need some dental technicians, some general surgeons, and again, some of these things sort of go without saying that a military would need, especially within a time of conflict and mass casualties. So why exactly is the government or the Canadian Armed Forces, rather, which is a division of the government, recruiting so many medical personnel? Why there's so many job openings at the moment? I can't really answer. I can only sort of speculate that it is for some future purpose, that they need the personnel trained and ready in advance for when whatever is going to happen, be it an overseas conflict or a deployment, whatever that may be, on domestic soil. One can only wonder and speculate, but I have given you a couple of options as to why that might be during the reading of this little look in to the career opportunities at the Canadian Armed Forces. Now, I think I have one last little article that we'll keep short and sweet to look at before we do finally wrap this up, although I did tease you earlier that we were wrapping it up at this article during recording. I did remember I have one last thing lined up ready for this presentation, and we will be calling it the day after that. So stay tuned, guys. We are nearly done, and thanks for those of you who have stuck around this long in this evening's feature presentation, Canada in Crisis. Right, guys, I promise this is the last article, and we're here at the wallstreetjournal.com, and we are going to read an article that starts out by saying the campaign to re-educate Jordan Peterson for speaking his mind. The psychologist could lose his license. Now, make of what you will of Jordan Peterson, and we won't get into sort of too much about who exactly he is. Could he be an independent psychologist, or is he part of the controlled opposition and an actor playing his part in the pantomime that is passed off as reality? But hearing the phrase re-education and hearing phrases or the existence of work labour camps are sort of somewhat disturbing, and sort of things you do associate with sort of communist Russia and Nazi Germany. But the release of the so-called Twitter files continues, with attention now to turning to Twitter's relationship with agencies, including the FBI and the DHS. Images courtesy of then. And you would think by now that Canadians have learned not to tell Jordan Peterson what to say. The psychology professor became an internet sensation in 2016 after arguing that Canadian legislation amounted to compelled speech on gender pronouns. Now the College of Psychologists of Ontario is demanding that Mr. Peterson acknowledge he lacked professionalism in public statements and undergo a coaching program / re-education program of remedial education, and remove the medial re-education. Maybe the new commissars missed Mr. Peterson's videos praising Alexandra Zlotnitzin, or how the fuck you ever say that, and the man who said, "Live not by lies." Mr. Peterson won't comply, and again, the non-compliance in "No, we won't comply" is the narrative of the counter-controlled movement in COVIDian era. But he also says that he will now face a disciplinary committee that could revoke his license to practice. The College of Psychologists, the profession's governing body in Ontario, appointed an investigator in March to examine complaints about Mr. Peterson's comments on Twitter and on the popular Joe Rogan podcast. Again, Joe Rogan, he is part of the controlled opposition, providing the counter-narrative for those of his followers, just like the Pied Piper who played the tune, and the children of the village followed him when they refused to pay him. But whoever does pay the piper usually calls the tune. But on November the 22nd, 11/22/33 there, the college panel released a decision per images provided by Mr. Peterson. The panel ruled the comments at issue appear to undermine the public trust in the profession as a whole and raise questions about your ability to carry out your responsibilities as a psychologist. What are these comments? Calling Elliot Page, the transgender actor, by his former name Ellen, and the pronoun her on Twitter. Calling an advisor to Prime Minister Justin Trudeau a prick, a sarcastic crack at anti-growth environmentalists for not caring that their energy policies led to more deaths of poor third world children. For also calling a former client vindictive, and objecting to a Sports Illustrated swimsuit cover of a plus-sized model, and he went on to say, "Sorry, not beautiful," and no amount of authoritarian tolerance is going to change that. And the writer of the article jokes, "In Canada, even offences begin with sorry." But the point of the matter is, these are comments that he's made on social media that have now got him into an awful lot of trouble, and he's seen himself facing a re-education program. Now, the point and the message that this is this staged event, and I do believe it is a staged event, but whatever you want to believe, that is up to you. Make of it what you will. Well, the purpose of the event that I believe is staged is to send the message that if we can send an individual which has, quite a high profile, he is a public figure, he is known globally, he is a celebrity, he may not be up there with the sort of Hollywood or sporting superstars, but he is a celebrity nonetheless, and he is a public figure, and he does have quite a large following. But if they can target an individual like that and send him or sentence him to a re-education program, then the message they are sending, boys and girls, if you are are in Canada, that they can come for you. And anything you have or posted on social media can and will be used against you, just as it is being used against Jordan Peterson in this example that they are sending to the nation and maybe to the world. But the impact risk in this case is significant. The panel found because the comments may cause harm, it counselled Mr. Peterson that coaching, again, they didn't cause harm, they may cause harm. It makes it even more preposterous and outlandish that he is being sent to education, re-education over comments he made on Twitter. But again, it's not about the nature of harm that was caused, it's the message that they're sending. It's not about what he said, it's about what they are saying and what they are telling you, that it can be anyone that can be selected and targeted for re-education if they have posted stuff that the Canadian government may not agree with. But the College of Psychologists declined to comment on the case, citing confidentiality, but Mr. Peterson responded sensibly. Who exactly was harmed, how, when, and to what degree, and how was it that harm measured, he says. There have been about a dozen formal complaints since 2017, and each one demanding a formal reply. One complainant cited Mr. Peterson's Twitter response to a critic worried about overpopulation. You're free to leave at any point. Mr. Peterson thinks the investigations are about mitigating harm, but preventing free aren't about mitigating harm, but about preventing free expression, which is pretty much what I'm telling you. Not to put myself on a pedestal with Jordan Peterson. It doesn't really take a genius or psychologist to sort of read what between the lines and see what they are really telling you with this incident. And that the process is the punishment, giving online detractors an effective way to badger him. Professional bodies are supposed to ensure that practitioners are competent and not enforce political orthodoxies or act as language police outside the office. But that's the trend in the Western medical associations and beyond. The Law Society of Ontario had pushed a mandatory diversity pledge for all lawyers until a members' revolt took over the board and mixed the pledge in 2019. At the time, an Ontario lawyer was objected to the ever-expanding mission to socially engineer the profession. It sounds like an issue of ID, ego, and superego. You could ask a psychologist about it. The article finishes by saying, and I believe there is a picture of Jordan Peterson in 2019. But as I said, guys, the message that is being sent here, that if anyone is a target for re-education, if they have said things that could sort of cause harm or go against the grain of a political correct society that is being rolled out before us, and re-education programs, labor work camps, these are all things from the realms of Nazi Germany and communist Russia back in the day. So thus we will conclude this stream and this preacher presentation on Canada in Crisis. I don't know what I've clicked on there, something to do with Elon Musk in Twitter, so we'll quickly remove ourselves there. But as I was saying, we are going to wrap this up now. So thanks for those to those of you who have stuck around to the very end, which I do imagine is a very few of you who started watching this, and then those of you who aren't watching won't even get to hear this. But nonetheless, guys, thanks for watching. If you do have any thoughts and comments, as always, I am very glad and open to hear them. So till the next one, take care.
Sit, Ubu, sit. Good dog.